So we have Dr. Adithreya now going to talk from one extreme to the other. The latest step up of Smile, which is the Smile Pro 800, which makes life far more simple and the results to be far better. So on to you, Adithreya.
Yeah, morning. So I'm just going to talk to you about the latest update in Smile now. It's called the VisionMax 800 machine. And so the procedure itself is called Smile Pro. So as we know now, Smile is now an established modality in the correction of myopia and astigmatism. You can correct myopia up to 10 diopters, astigmatism up to -5. So the new update of Smile has significant advantages. The quickest update is that it only takes 8 seconds now for us to finish the laser application. So this will significantly reduce your chances of suction loss happening once the laser application starts. Second advantage is now that the cyclotorsion compensation that was absent in the older machine is now been incorporated in the newer one. So in case your patient has a significant amount of cyclotorsion and they have a high cylinder, the treatment effect will not be compromised. So as we know, these were the drawbacks with the older machine. Here is a video of the docking with the VisionMax 500. As you see here, one of the disadvantages was it was not very easy for you to make out the pupil center when you're docking. Until the cornea is very close to the contact glass, you couldn't really make out the pupil center. One would have to make an educated guess as to where the center is and ensure that the pupil is right at the center of the treatment application. So now as we see here, the laser is about to start. Laser takes 22 to 30 seconds in the 500. As we see here, this is the posterior cut. This is the scary part. Now the patient cannot see the green dot very clearly anymore, and then this is where they start to become a little uncooperative. So this is when the anterior cut happens. This is when you have to hold your breath and instruct the patient to not make any sudden movements and keep both eyes open to ensure that there is no saccades happening. So this is the new machine. The difference is now the two arms move up and down. The bed doesn't move per se. The bed remains static. You'll have to bring the first arm down first for the laser application. And once the application is done, you can bring the second arm down for the lenticle dissection. So one can actually modify this technique and go about it whichever way you wish to. You can finish the laser application on both eyes and then move to dissection for the both eyes. But what I do is I do usually tend to finish the laser application on the right eye first, move the arm up, bring the second arm down, finish the dissection, again switch the arms again, laser application the left eye, switch then do the dissection. Reason being is I don't like to keep both eyes open for a long time. The cornea gets too dry, you can have epitheliopathy in the post-op period. So this is my preferred technique. So again, these are the advantages. 8 to 9 seconds of laser application. Pupil centration is very easy to do now, because now in the heads-up display of the Smile 800, you can see a guide as to where exactly the pupil center is. You can even enter the pupil coordinates on the X and Y from a topographer machine. If you have the series, those coordinates will match up with the 800. It tells you where exactly the pupil center is, and you can dock in the correct accurate position. So cyclotorsion is also addressed here. This is an external view of the 800 docking. As you see now, the docking arm is and docking is seen given to you in an external monitor. It's not that you have to look into the binoculars anymore. As now you see that the external monitor, you're able to very clearly make out the pupil center, and there's a guide. You will see the yellow line there. It tells you to move towards that yellow line, and once you dock on the yellow dot, that is where your pupil center is. So you can map out the coordinates exactly, and once you activate suction, you can start the laser application. It only takes 8 seconds now. So posterior cut is over. That's about 4 seconds, and now the anterior cut is done, and that's your side cut. So that's all it takes to finish your laser application in the new 800. So this is the docking, which is seen through the video recording of the VisionMax 800. As you see here now, you can very clearly make out the pupil center. It's very visible to you, and go ahead and dock. So we are bang on the pupil center now, and once we turn on suction, laser application begins. This is now being shown in real time. So you see it's very fast to finish the posterior cut, side cut, and now the anterior cut. And this is the incision opening. That's about all. The rest of it is quite standard. This is the dissection technique that I usually use. The other advantage now is the optics in the VisionMax 800 are much better compared to the 500. You're able to see the planes very clearly. You can make out which plane you are in. A lot of times in the 500, you were more dependent upon your proprioceptive feedback that you felt at your fingertips, because sometimes the planes weren't very visible to you. The advantage in the 800 is, since the microscope is so much better now, not only can you feel the resistance that you need to feel at your fingertips, you can also see very clearly which plane you are exactly, and go ahead and finish a dissection quite fast. So this is just a standard dissection technique. I'm not going to dwell too much on it because, as you know, the other two speakers have covered it very extensively. So this is a study we have done comparing our outcomes between the VisuMax 800 and the 500. So what we did was we had 72 eyes in one group and 72 eyes in the other group, all of which were compared by the standard methods of refractive surgery reporting as recommended by JCRS and ACRS. So group A were patients who undergone SMILE with the 800. In group B were patients who undergone SMILE with the 500. Inclusion criteria and exclusion criteria are all standard for refractive surgery practices. We use the method of getting best correction and standard corneal topography, and all of which were done. And all patients were above 18 years of age with good topography and standard refractive stability for the last 1 year. So patients with the group 1 treated with the VisuMax 800, they were marked preoperatively with the limbal markings in the slit lamp. We marked the 0 to 180 degrees using a needle. And once the patient was shifted to the operating room and they were made to lie down, we use a gentian violet marker to ensure the 0 180 degrees were made more visible. And once the docking was done, you can go ahead and incorporate a circular torsion compensation. Whereas in the VisuMax 500 group, we did not incorporate the circular torsion technique as it's not really recommended by the company. So these were the comparison of the preoperative parameters between the two groups. As we see here, both the groups had no significant differences in the preoperative sphere or cylinder. Here are the results with group 1 with circular torsion compensation. You see here that the results are quite fantastic. The spherical equivalent refraction was quite good. All patients were within half a diopter of sphere after the procedure was done, and the results were stable for 3 months. And refractive astigmatism is where the SMILE 800 really scores. As you see here, about 100% of patients were within half a diopter of cylinder. TIA and SIA were quite close to each other, and here is where we saw a difference in the angle of error. All 85% of the patients were within -5 to +5 degrees of angle of error. Very few patients were between 5 to 15 degrees. And this is the results of group 2. This is the patients with the VisuMax 500 treatment without circular torsion compensation. Again, there were no lines lost, but you see here that the cylinder treatment is a little worse compared to the VisuMax 800. As you see here now, in the angle of error, when we look at that, still 88% of patients were within 5 to 15 degrees, but there were some patients who had angle of error between 15 to 25 degrees. This is the vector graph analysis. As we see here, this is the difference between target astigmatism and surgically induced astigmatism. That is the amount of astigmatism treatment that you intended to treat the patient with. The first group, the vector mean is only 0.22, whereas in the second group, with the VisuMax 500, the vector mean difference was 0.37. So it is a little more accurate with the VisuMax 800. And this is the comparison of the post-operative parameters between the two groups. Sphere was very good, but VisuMax 800 scored a little better. Cylinder, again, the VisuMax 800 scored a little better compared to the VisuMax 500 group. But when you look at the comparison, there was no real significant statistical difference. The VisuMax 800 group, the difference was patients actually gained 1 line. There are a few patients who gained 1 line and a few patients who gained 2 lines in comparison to the best correction. Whereas in the 500, there was no gain of lines per se, but there was only 2 eyes which had a loss of 1 line. The main difference is the post-operative cylinder angle of error was less in group 1 with circular torsion compensation in comparison to group 2 without the circular torsion compensation. So I conclude by telling you that circular torsion compensation in SMILE gives you slightly better results when treating myopic astigmatism. Your rates of suction loss will be considerably less because the laser application time is only 8 seconds now. It is an improvement over the older generation. But again, one need not be disheartened that you have to only invest in the newer machine. When you really look at the publications, we know that the amount of cyclic torsion that occurs in 90% of patients, so it's only 2 degrees. So that's not really much. It won't compromise your results in more than 95% of your patients. But when you do have that small percentage of patients who have a high cylinder and they have a higher degree of cyclic torsion, that's when your results can be compromised. One way to minimize this is to instruct your patients before the procedure begins that they should not squeeze down on the speculum, they should not try to close your eyes forcefully. When they do all of this is when the eye can cyclotort and you can have compromised results. As long as you reassure them, give them the proper instructions before the procedure, you can really minimize the chances of this happening and still give your patients good results if you still have the old machine as well. And thank you for your attention.